Hi friends, Namaste and good evening from Richardsons Face Hospitals, Bengaluru. So my talk today is going to be on this very interesting and challenging subject of a redo rhinoplasty or a revision nose job or a redo nose recontouring, restructuring, reshaping procedure. Now I'm going to be talking only on redos or revisions. But before I do that, I want you all to understand what a redo or a revision is and why do you have a redo or a revision. Don't always assume that a redo or a revision is a nose that has been spoiled or botched up by a surgeon. That's not the case. I've been performing these surgeries for around plus 2 decades, and what I've seen in my experience is that the patient's desires could also be a need for a redo. Very often, the patient is not expressing the exact desire to the surgeon, thereby leading in the nose shape or nose form that they don't like perfectly. And then there's a redo. So redo could be because of that. Rarely redos happen after an infection from an earlier rhinoplasty. Rarely redos can also happen because it's a botched up nose job. Yes, that also is one of the reasons for a redo. All right, so you can have redos with multiple reasons. Now, does redo require better skills? Absolutely. Redos are the most challenging aspects of rhinoplasty or nose jobs. Why so? Simply because nose is very delicate. You have a very, very fine balance of the nasal bones, the cartilages around there, the mucosa and the skin draping it. And if you cause a scar, there's retraction. If you cause issues with the complex of the tip or the dorsum or the bones, then you can have issues. If you have some issues with breathing, then you look at septoplasty, septal reconstruction, internal valve reconstruction. So it's a gamut of things that we can cover. So let's say a patient has a redo. Why is it just plainly difficult? The first and foremost reason is, as a surgeon, when I'm looking at a redo, I'm not only trying to see the issues patients having, but also trying to find out what was done in the last couple of surgeries by the earlier surgeon, because only then I can correct it or give a better solution. So this is more challenging. Sometimes there's a lot of scarring. Well, sometimes it gets easier because the surgeon has placed a big silicone implant and it's through bulbous tip. We all know we can see the implant, we can feel the implant, I can measure it out in the scan, so it's pretty easy. So I know, okay, this needs to go, and we can do blah blah with the tip, we can get the rib cartilage done for the septal extension graft or for the spread of flaps, whatever. Now, every time it's not like that. Sometimes the earlier surgeon or the earlier person has already used different types of grafts and they don't have a discharge summary. So it's because the patients don't have a detailed discharge summary, I'll have to first ascertain as to what are the different types of grafts, for example, that has been done by the earlier surgeon. Was there a marginal rim graft? Was there a strut placed? How was the spreader flaps used? Was it used? What about the hump? Was there done an osteotomy? So these factors have to be put inside with the complaint of the patient, and then you have to arrive at a solution, or the problem has to be solved for the patient. Because sometimes or very often what I see is the patients in India don't like an upturned tip. So when you look from the side, the tip goes up. Even the other week, I did a patient who had the primary done in the country of Turkey, and they've made this tip beautiful, but the patient doesn't like it simply because the tip is upturned. So from front, you can see the nasal opening. Now, that could be aesthetically pleasing in some part of the world for some people, and in another geographical location, it isn't, really desired. So that's another reason for redo. You go to another place, get a nose job done, the surgeon is only doing one particular types of noses, and therefore you get a nose that probably looks like a Korean or a Turkish or an European or a Caucasian, whatever it is. And then, so you got to be really clear, is that the type of nose I would want? Will that suit my face? Because you have to remember, there's nothing like a perfect nose. Noses have to suit faces. Noses have to be made for faces of the races. So depending on your ethnic background, depending on all these factors and also about your personal desire, what is it that you like? What is it that you're comfortable with? And keeping the functionality of all of it at the same time. So you cannot give a great, beautiful looking nose that the patient has, blocked nose, for example, along with that. So you have to that has to be fixed as well. So on a typical month, years back, I used to do 1 and 3 and 2 redos. But nowadays, every week, I'm literally doing 5, 6, 7 redos. So good percentage of my work is turning out to be redos. Why? It's not because of anything. I think it's because there are more and more people in India who are choosing to get rhinoplasties done. There are more and more people across in this huge country that are performing rhinoplasties. And so a lot of the patients are not very happy. So it's a very fine surgery. So I think before you decide to go to the rhinoplasty surgeon, you have to really choose to go to the person who's got good experience, lots of patients to show you before after results. Anyone can do a morphed image and say, look, this is how you are. I'm going to make you like this. Software is different. Handwork is different. So I think these are the factors that you have to consider before you go and get a nose job done in the first place. Now, having said all of this, I'm going to get to this very important point. Some patients do ask me whether my patients also go for redos. Now, answer is yes. I have to be honest. It is yes, because if I do 100 patients, and I think in the last audit, we found that about 5% of the patients might want to get some kind of redo done. Why is it around 5%? Well, because sometimes we're not able to get exactly what the patient desires. Sometimes it's done a little bit more. Sometimes patient has a small bump after surgery and that can cause a deviation in the tip. Once in a while, that's also a factor, because you know what? You have to understand that the nasal bone fracture, nose trauma, is the most common trauma of the human body. And therefore, post-rhinoplasty, post-nose job, there is a 4 or 6 week period where you really have to be careful, no matter who does the surgery. And in this window, a lot of patients can do things by mistake, or can happen that the nose goes through something that then needs a fix up, a redo. All right, I want to touch the last point now, because I can go on talking on redo. The last part of a redo is not all redos are major. So sometimes you can have an asymmetry in the shape of the ala. That's a daycare redo. Sometimes you can have problems with the tip. And if the patient's very particular about just the tip projection or just the tip angulation, might be possible in a couple of days. And yes, if you have to work on the nose, especially the bony vault, the bone of the nose, the dorsum, and the cartilages around with it, then I think you're looking at a total redo. Now do remember, redos take more time to heal. So therefore, you have to add a week more than the primary nose job. This is another question I also get quite often asked. So doc, I've already had 3 surgeries done. Is a 4th surgery a possibility? Now, I think it doesn't depend on how many surgeries you've had before. I've had patients who have had just 1 surgery before, and I've turned them away, telling them, look, I can't do surgery for you because I think their expectation is too high and I cannot deliver that. Or the issue has become so severe just after 1 surgery that I might not be able to give them more than 60 or 70 or 80%, whatever I think it is. So it doesn't depend. And sometimes patients have had 5, 6, 7 surgeries. I've had patients on whom I've done the rhinoplasty for the 10th time. I mean, they've had 9 surgeries. I'm not exaggerating one bit, because they've gone through, especially patients with clefts and others, have had multiple surgeries. Growing up right from age 6 and then 10 and 15 and 18 and 25 and so on and so forth. But can you improve those noses? Yes. And sometimes, absolutely. And in sometimes, just have had 1 surgery elsewhere and I'm like, no, I don't think we can improve this much. So really, the number of prior surgeries that you've had before doesn't give me an idea whether I could improve or no. It depends on what you're expecting, what I'm seeing on the scans, what I'm feeling on your nose, and what I can deliver. If what I can deliver is what you'd be happy with. If the improvement is going to be a high significant percentage, then I think you're a good candidate for a redo, and I think you will get accepted here. I think that's what pretty much most rhinoplasty surgeons, experienced surgeons across the world do. So this is the understanding for redos. Today, I think in this last week itself, I've done 3 redo rhinoplasties. And a lot of the redos, we are also not posting because the patients are not happy with us to take videos and put it. But I try to put as many as possible so that you understand how even severely botched up noses can be fixed, how even after you've had 5 or 6 or 4 prior surgeries and you're not satisfied, can get you better results. So I think for all these redos, consultation is a must. I need to feel the nose. I need to get a good detailed history about what all was done. Need to see your scans, and then we can sit and then we can take it forward. So what's the take-home message with a redo or a revision nose job or a redo or a revision rhinoplasty is that it is possible. So do not lose hope. Please try to come for a direct consultation, because that's when I can give you more information rather than an online consultation. And most importantly, it will vary on what your expectations are to what I can render. That will decide if you're a good candidate for surgery or no. Hope this was useful. You have any queries with regards to rhinoplasty and whatever questions you have relating to redos or revisions, please text us. We'll be more than happy to get back to you. You can have an online consultation if you're living very far away. As I already mentioned, nothing like a direct personal consultation too. Bye-bye.